So welcome everyone to this afternoon's webinar, Stabilizing Condom Markets and Revisiting a Total Market Approach. My name is Lucy Maikweki. I'm the technical lead for the Condom program at the South to South Learning Network. And it is my pleasure to welcome you to today's session. We are hoping to have some lively discussions and reinvigorating the program, the Condom program, hoping our discussions will lead to greater focus on increasing access. As we wait for people to join, welcome so much. We are just curious to know, where you're joining us from. So you can say hi in the chat, just say where you're coming from, where you're listening to us from. If you have a question, you can put up your hand and, we will be able to give you that opportunity to speak during the discussion. So just put your name on the chat. As we wait, give it one more minute and we can get started. Just giving a few more people time to join. Otherwise, welcome. Welcome everyone. Shiva from Zambia, welcome so much. Elliot, welcome from Sanak. Wanjiro Mukoma, longtime friend, welcome. Moses Mulindo from Uganda, welcome. Kabo from Botswana, welcome. Welcome, Brian. Okay, so I think we're going to go ahead and get started. We're going to go ahead and get started. As we said, today's session, today's webinar is about stabilizing condom markets. And the reason why we are thinking about stabilizing the condom markets is because we are in an unprecedented season where we have reduced funding. We have also new HIV prevention tools and products in the market. And the question we are asking is, how can we then use the total market approach to stabilize the condom markets? With us today as our moderator, we have Rosemary Kidiomunda from UNFPA. We have Chris Jones from Mann Global Health, and we have a host of panelists that will be introducing themselves as we go along. And then we will be able to also have a session for Q&A. But without wasting much time, I want to hand over the mic to Rosemary to just introduce ourselves. We also have opening remarks from the Global Fund. We have Susie McLean from the Global Fund, who's also going to be making some opening remarks. So over to you, Rosemary. Welcome.
Thank you, Lucy, and thanks to the South Learning Network team for this historical event, if I might say. I'm Rosemary Kindiomunda. I'm the HIV Technical Advisor, the interim at the UNFPA Regional Office, East and Southern Africa. And I must say that I'm a satisfied condom user for that matter. So I'm very glad to be here. Just speaking from Lucy, we are all aware that condom is well known for its prevention properties against unintended pregnancies, STIs, and HIV. And these are still critical issues across all regions, and especially this region of ours, among adolescents, young people, and key populations. But we also know that we've had declining trends. One in condom use, at last high-risk sex, over 5-6 years maybe, and also a decline in the volume of the commodity, the condom commodity in the same countries that would need the condom a lot. And we also that the decline may be partly due to the low prioritization, perhaps due to competing priorities, as Lucy has indicated, that we have more tools in the box. But we also know that we have the drastic cuts in funding, which are not only affecting condom, but other areas, and therefore we might be hard hit. And we are yet told that the condom is among the most cost-effective interventions for leading us to declines up to HIV elimination targets. So this particular conversation today is quite useful because globally we know that partners are looking for all ways to transition HIV programming from vertical dependent on external funding to local solutions that countries can use for sustainable programming. And this discussion on condom market transitions is very critical at this point because we know that we've always had a love-hate relationship between the free-to-use condom and the condom at a cost or at a discounted cost. And now we are nagged to actually face the discussion and see where it takes us. So today we have a short program, if I can say, in an hour and a half and maybe now in an hour and 40 minutes, where we'll hear from some expert interventions, but also pick from a panel of experts across government and the private sector partnerships to understand whether what we are talking about to transition markets is actually feasible, and then what we need to do to actually fast track that. I will start with the objectives of this particular, if you can flag the objectives of this webinar. One, to revisit the importance of condoms to reduce incidence, HIV incidence, based on new understanding of epidemiology and funding context. And secondly, to present an updated vision for the role of total market approach. For many of us, we've heard about that. Let's see how we take it into practice, rooted in country realities and market data that supports a more sustainable, equitable, and resilient condom market and can inform planning and procurement decisions, especially for Global Fund, the coming cycle, and other donors, and engage country-level decision makers, technical partners, and global stakeholders in a practical discussion on how to operationalize TMA in our different contexts. And finally, to foster South-South learning by drawing on experiences from countries like Kenya, Uganda, and Zimbabwe across the sectors where we highlight both what we are doing and the challenges. I will now invite Chris Jones from Mann Global Health to give us a presentation on stabilizing condom access through the TMA route. Chris is a long-term expert on condom programming, so we are in safe hands. Chris, over to you.
Thanks, Rosemary. And thanks to colleagues at SSLN for hosting this important seminar. I think it's particularly important given today's context of funding declines and transition and prevention programming. So as Rosemary said, my name is Chris Jones. I'm working with a team from Mann Global Health who has been working alongside colleagues at UNFPA, UNAIDS, USG, Global Fund, and other upstream partners to help understand condom market dynamics and working directly with national programs to support country-specific analysis and interventions. So the analysis I'll share today draws on an update of a global landscape we conducted earlier this year and have been working on really for the last 7 years, and our many years of experience supporting global and country-specific programs. I'd like to start by presenting the context of where we are today and the role condoms play in prevention efforts. I think it's a good reminder of the role of condoms, and shift into how we can draw on a concept, TMA, that's been around for a very long time to help support sustainable condom markets in a challenging funding environment. So we do know top line. Condom programs are struggling, and this happened even before the latest withdrawal of USG fundings. And now, whereas in the past, support for demand was a concern, moving forward, we're concerned that even condom supply is that there's not enough to meet the need, and are now a concern. But we also know and believe that a healthy, sustainable condom markets are possible with the total market approach that creates the opportunity for what we refer to as the sold market, which is the commercial sector, the pure commercial sector, but also evolving social marketers, which have made efforts to transition to viable social businesses, which are more sustainable. And we'll talk a bit more about that. And we have a panelist that can share their experience from Kenya. So the commercial sector, we believe, is poised to do more, and social marketers can transition to a sustainable social business model if done right and in the right context, and we have demonstrated proof of that. The public sector continues to need support with stewardship functions and support specifically with how to operationalize the TMA. And finally, meaningful integration into broader HIV prevention and SRH interventions is going to be the key for condom programs moving forward. It's no longer possible or viable to look at a condom program as a vertical, standalone, siloed program. Okay, next slide, please. So just some analysis, big picture of both supply trends as well as demand. So on the left, we see trends in supply, procurement supply over time, and we have seen really an alarming decline of almost 37% from peak procurement in 2011 levels. Most donors, with the exception of the Global Fund, which actually improved or increased funding over the last funding cycle, have seen declines in support for condom programming. And that is largely driven by the treatment mortgage and support for effective ARV programs, but also the appearance of other prevention modalities like long-acting PrEP. So that decline in supply is also running concurrent to a falling demand and actual condom use. So in every country that we have recent data for, which includes Kenya, Zambia, Tanzania, and South Africa, we've seen declines in critical populations, particularly youth. Just to highlight South Africa, we saw youth condom use decline 17% from 51% to 51% from 68%. So every country that we see recent data declines in use. That's a concern moving forward. But we also know that condoms are a more important tool than ever. And this slide just represents some of the big three challenges for confronting prevention, but also a potential solution. And that this, the findings here are a compilation of the latest epidemiological data and modeling compiled by Jeff Eaton from Harvard University. So first, number one, a slowing in the rate of decline of incidence means it will be more challenging and more expensive for every new HIV infection averted. So this is also a success story. The decline in incidence is reflective of viral suppression by effective treatment programs. But it also means that as incidence reaches very low levels, it's going to be more expensive and harder to avert future infections. Number two, diffuse clusters of transmission in Africa contributes to an epidemic of many who infect few. The evidence in Africa shows that unlike the epidemic in the US and Europe, cluster busting approaches are not as effective as transmission occurs by many individuals who are infecting a relatively few number. This is especially true of incidents outside of key populations in the general populations, countries with high HIV prevalence and incidence. And number three, because of this diffuse nature of the epidemic, it's very hard to identify individuals at risk through risk tools. So a recent study in Zimbabwe demonstrated how young girls that score low on a risk assessment at baseline account for 40% of new infections just 1 year later. Those are infections for STIs and HIV. So all three of those factors point to a need to reach more populations at moderate risk with low-cost prevention approaches. And A broader approach is needed to reach men and women, and particularly young men and women, in higher prevalence geographies that are simply by being sexually active going to be at risk of HIV, STIs, and unwanted pregnancy. Next slide, please. So condoms work. We've got a lot of data to demonstrate that they are highly effective. They were and are the first multi-purpose prevention technology at our disposal by 3 or 4 decades. They are effective against averting STIs, HIV, of course, but also for family planning, particularly, again, for young people. They are one of the very earliest and generally effective self-care innovations. As long as we can get a condom in the hands of an individual, they've been demonstrated to be able to be used. An early innovator in differentiated service delivery. Again, condoms are and can be supported in delivery through the commercial sector, kiosks, small shops, non-traditional outlets, virtually any outlet where individuals at risk of HIV can be found. And modeling repeatedly shows that they are one of the lowest cost and effective and proven interventions at our disposal. So the chart on the left shows the role of condoms in averting over 117 million infections since the last time we have modeling data, and this data is being updated. On the right, we're looking at the role of condoms for future incidents, where we see those upper orange and purple tabs indicate what happens if condom use declines by even 15 or 30%. We will not only see a halting in the decline of incidents, but also potentially an increase. So just, again, the evidence is there to indicate the role and use of condoms. Okay, moving forward, what's behind the decline in use? To the next slide. Gaps in public sector condom supply is and has been impacting use. So as I said earlier, competition for funding and attention comes from ART programs and treatment commitments, as well as the role that long-acting PrEP is playing. All effective interventions, but they've been taking a lot of air out of the room in terms of conversations. But also poor quantification and planning has resulted in many, well, I would say almost all public sector programs in over and under supply and worrisomely stock out. So in some districts, we may see expiring condoms that are wasting, whereas others experience stockouts because condoms are notoriously difficult to manage as a commodity. Number 2, social marketers' role in condom markets has significantly changed. 20 years ago, social marketers were leading the role in demand generation, as well as condom access. And as funding has shifted to other interventions and social marketing fell out of favor, that has had a negative impact on condom use. And finally, we believe innovative public sector actors have been underutilized and often sitting on the sidelines because of distorted subsidy. Next slide, please. So 2 key insights demand a path forward to stabilize condom markets. So first of all, the decline in supply with corresponding drops in demand and use of condoms is now a real concern. In the past, as I said, demand was the primary concern, but we had generally condoms available. That's no longer the case. Many countries are facing a precipitous decline. Zimbabwe is anticipating a $10 million gap next year in condom supply. Uganda, a similar gap, and really any country that was reliant on USG resources for funding their condom programming. But number 2, we believe a total market approach is a missed opportunity to sustain healthy condom markets. And donors and national programs and stakeholders are looking for opportunities to operationalize the concepts underpinning a TMA to harness the potential of all sectors in the market. So diving a bit into what is TMA. Again, a concept that's been around for quite some time. The total market approach, it leverages the comparative advantage of the public sector and sold condoms, including social marketers, social businesses, and the commercial sector, to increase use and sustainably meet needs. So we believe if we implement interventions that create space for all market players, including particularly the commercial sector, to play to their comparative advantage, then we'll expand access and demand for condoms, which will lead to a healthy condom market, which we define as one that is growing equitable use while decreasing reliance on external donor subsidy. And that ultimately will result in sustainable decreases in HIV and STI incidence. So next slide, please. TMA has been around for a long time, 20 plus years. I was in a program in Cambodia 23 years ago, implementing a total market approach program. But it's still, we still struggle to translate it into specific activities. So why has TMA struggled? Number one, we have been frogs in boiling water. The threat of reduced donor funding has long been predicted and long been discussed, but it is only now being realized. And unfortunately, we're going to be realizing it in reality from really today. National programs have struggled to translate concept to operational plans in support of a TMA. And decision makers often believe that free condoms are a right under UHC principles, which has driven large numbers of free procurement. And we want to emphasize that a TMA calls for the role of free condoms to be distributed to those who cannot pay for those or high need individuals, but also looking at the opportunity to open up markets for those individuals that can pay to access commercial or social business supplied condoms. Let's go to the next slide. So we've boiled down the fundamentals of a TMA into 3 specific steps to really focus on. One is it's important to know your market and create a vision for sustainability. Understanding and identifying gaps in demand, supply, and distribution channels is a critical first step towards the total market approach. And then beginning to look at opportunities to segment markets by ability to pay and those that cannot pay that should and need to have access to free condoms. And then finally, appropriately quantifying the need for free condoms through the use of existing tools like the condom needs estimation tool that the UNAIDS has promoted can help to inform procurement decisions. The second critical element of this is to work and stop distorting markets with misplaced or untargeted subsidy. In the past, free condom programs have often inadvertently crowded out the sold market and kept commercial sector actors on the line, which has negatively impacted sustainability. It's now time to begin to graduate social marketer programs if they are reliant on external subsidy to social businesses. And finally, there's an opportunity to activate the sold market, the commercial actor markets. And we've got some panelists today that will talk, commercial actors talk about their experience and working in this space as well. So next slide, please. When we talk about knowing your market, this analysis can get overwhelmingly complex and it need not be so. Sometimes good enough is going to be appropriate to create a vision for a healthy market. But tool supporting analysis are available, but at the very minimum, we need to understand supply trends, who are and is providing condoms, including free distribution and getting a dial in on which donors are supporting free, but also the role of the commercial market as well as social businesses. Basic demand trends based on data that is available, including DHS, FIAs, or IBSSs are going to be important to understand use. And then where it's possible, understanding gaps in commercial sector needs around business financing, the role that the enabling environment plays, like taxes and standards, regulations that may inhibit some aspects of the market to play a larger role. So again, we have some tools that are available and we'll be beginning to roll those out.
5 minutes, Chris.
Okay, thank you. Second element here is it's important to relook at and work to stop distorting markets with untargeted subsidy. So on the chart on the left shows the role that in Zimbabwe of free and social marketed condoms. So 25 years ago, Zimbabwe was a country that was 72% reliant on an effective social marketing program. Today, it's 90% plus reliant on free public sector distribution. That is a challenge that they'll be confronting with because of the need to fill in that gap as donors retreat. So who's going to be providing and supplying those condoms in the future? Also on the right, sorry, is looking at the role that subsidized social marketing programs can play, often inadvertently in leakage. So this is Malawi's social marketed brand in Zambia. Because the brand is very low cost, it is leaked across borders. So I want to get to one slide in particular. Let's go to 14. If we slip 2 slides. These are some basic questions that we need to be asking at the country level. So for the public sector, as we begin to shift towards the TMA, then I want to just really quickly show what's possible in a future market. Critical questions for the public sector is we need to really understand what the actual need is, which population segments are most in need of free public sector distribution, and can they be prioritized? What level of procurement can domestic and donor budgets sustain, which is probably the most important question. What are countries going to be asking for in GC8 and from other donors? For the sold market, it's important to understand how we can expedite commercial and social businesses under a timeline to understand, then invest in market opportunity. So let me conclude with this slide here, a potential vision for a healthier market. This is a slide that draws on actual data from a country in sub-Saharan Africa. Now let's go to the back one. There we go. Which shows a market that in 2024 was reliant on 92% of the market was driven by public sector free condoms. So a hypothetical solution moving forward is how can we support and sustain use if there are fewer resources available? So in this hypothetical model, we see that if we begin to align procurement with actual use of free condoms, we improve efficiency and free distribution through better targeting of those that actually need free. And critically, we reduce wastage. Many countries, there is up to 25% wastage in the system of condoms that expire because they're not used and get out of the central warehouse. We begin to create a more favorable environment of the commercial sector and de-risk market entry for the sold market or the commercial sector. Then we can reduce public sector procurement, creating savings in this hypothetical scenario up to $3 million per year. And that gap can be filled by the sold market, where businesses and social businesses step in to play a larger role. This will result in a stabilized, or at least maintaining current use, and averting, hopefully, the decline in use over time, while reducing reliance on external subsidy. So we have, with funding from the Gates Foundation, just go to the next slide, please. We have some resources to support operationalization of a TMA. I will let this slide, you all read this in the deck that goes out to participants. But please do reach out to me. We've got resources in the play. We'll be supporting some priority countries directly, as well as other countries indirectly, in supporting how to operationalize a total market approach and understand how to engage commercial actors, social businesses, and others. So looking forward to the panel discussion, because there's going to be a lot of opportunity from the social businesses and commercial sector and actors to really understand how this plays out in reality. So thank you very much.
Thank you, Chris, and for being on time. I know we've skipped some slides, but members will see the content later. Thank you for thrashing through the key aspects, the key issues. The commercial sector is viable. The public sector needs keen stewardship, and we need to shift from vertical programming. I love the 3 epidemiological challenges, especially around many infecting few in our region. Condoms work, and they are the lowest cost-effective proven intervention. And we now understand why we have the declines in condom use. I think it's not an accident. And the fact that we have supply insecurity, we can't hide from, and we have TMA as a missed opportunity. But I want to keep participants, keep your focus on the 3 fundamentals of TMA. Know your market, stop distorting it, and activate the sold market. I think later on, Chris will explain more on that sold market. I think picking from willingness to pay that we pick from several studies. I think we will move on as you drop in your questions, your comments. I hope Susie is online now. Susie, are you there?
Yes, I am.
Yes. Colleagues, let's welcome Susie McLean, the head of HIV prevention at Global Fund. And I must say that she is the best champion for Condom, especially with the programming conditionalities we had for GC7 that have seen some spikes in condom programming, especially in this region. Let's welcome Susie to tell us more about what is likely planned for the GC8. Over to you.
Thank you, Rosemary. Thank you, Chris. And hello, colleagues. I'm Susie McLean from the Global Fund. I'm the HIV prevention lead, as Rosemary mentioned. And I'm joined by my colleague, Carla Rodriguez, who also works with me on the condom agenda at the Global Fund. I don't have slides because I just wanted to make a few general comments, really. I think the kind of meat of the content, if you like, Chris has set out just now. And I wanted to, just comment on it, really. And I hope that my comments, I'm going to try and keep my comments quite brief, with the intention, firstly, of being super clear about the Global Fund's interest in this area, but secondly, to save a bit of time to get on to the speakers that follow me. So, my first message really is how much we welcome this session and welcome this discussion, and in particular, welcome the approach, this kind of total market approach with sustainability of condom markets in mind. Let me be super clear that the Global Fund shares this interest. I hope that many of you who are on the call will know that the Global Fund's interest and commitment to prioritising condom investments is really clear. I hope that's really clear in our guidance. And for those of you who know about how our investments pan out, you will see that, in fact, condom investments are our largest HIV prevention investment, demonstrating that, condom investments are really high priority for the Global Fund, and that continues. As Chris mentioned, we also, the Global Fund, just yesterday we released a kind of quite a high-profile media release about our big interest and commitments to, for example, lenacapavir and other forms of PrEP. And so I suppose what I just wanted to signal here is that we see these things as complementary and not competing. So the Global Fund's not turning away from condoms to focus on long-acting PrEP. We see PrEP in all its forms, alongside condom programs, alongside harm reduction programs, for key populations everywhere, and in particular for adolescent girls and young women in East and Southern Africa, as these really complementary HIV prevention investment priorities. And I really like the way Chris described some kind of prioritization or planning considerations about how, we might target more costly interventions such as long-acting PrEP towards really high need, people with very high HIV prevention needs, and but for much larger numbers of people, in particular young people who are sexually active, that condom programs are both highly effective, very cost effective, and terribly important to continue. But Chris has also touched on some of the additional strategic issues, and again, the Global Fund shares or recognises these also, and shares some concerns in terms of the future of our investments. So, as many of us know, the picture for donor investment in HIV, in international development, in HIV and in HIV prevention is a very unclear space, and I certainly can't provide here any guarantees for the size of the level of investment in global fund condoms program, global fund condom programs going forward, because nobody knows. Nobody knows what the outcome, for example, will be of the replenishment, global fund replenishment processes happening later this year. But I think all of us can see how much the landscape is changing. And so with those changes and greater uncertainties in mind, we can definitely see that we need to move faster and more purposefully towards sustainable, just so that we're investing in sustainable condom markets. Perhaps there won't be as much money available for global fund investments in condom programs for grant cycle 8. I have no idea. Nobody knows. But I think we need to plan for the possibility of that. So, yeah, just a final couple of points really to say how much we recognise the ongoing importance, potential threats or uncertainties around the ability for the Global Fund to sustain current levels of investment. And then therefore this work that Chris is referring to and these concepts around kind of regenerating focus on total market approach is really, really important to us. And so some of the things that we're talking about, thinking about, we're translating into guidance for grant cycle 8. Some of these concepts that Chris has already touched on, for example, the need to be increasingly clear about how we're targeting subsidized products. We buy a lot of condom products, and I think collectively we'll need to be getting clear about, are we really targeting very high need people with those free condoms, and therefore for other people at kind of slightly reduced risk of HIV infection, can the market serve much larger numbers of other people? And therefore, a big one for us is, what do we invest in? So some of you will also know that we've tried to evolve our investment approach so that we're not just buying product, we're not just procuring condoms and lubricants, but we're also been much clearer in the last cycle about our interest in funding upstream activities, so program stewardship activities, much more focused demand creation activities targeting young people, and more focus on, for example, strengthening the last mile supply of condoms to really important locations such as bars or brothels. So let me be clear again, that interest in us funding upstream activities so that stakeholders in countries are able to plan for more sustainable total market approaches to condom planning. Let me be really clear how interested we are in funding some of those activities. So I can kind of see a picture that over time, our investment in product reduces as our investment in the kind of planning and sustainability, total market approach type interventions increases, so that over time, countries are less dependent on the Global Fund for product, and that there's a greater space for social marketers, for the commercial sector, and that in fact our investment is not harming these markets. So yeah, as countries start thinking about Global Fund GC8 applications, or indeed in the work that's going on in a number of countries right now around reprioritization of Global Fund grants, I just want to be really clear that we would so welcome proposals or plans that we might see through the Global Fund processes, CCMs, applications, etc., that in the first instance continue to prioritize condoms as part of the overall focus on HIV prevention, that countries are increasingly seeking support for the development or the delivery of TMA strategies. We're interested in funding the development and delivery of total market approach strategies. And we're really interested in seeing and supporting where we can with our financing like stewardship efforts that, for example, encourage HIV prevention planners and actors to be working much more directly with SRH family planning actors, that we would know that the kind of management of condom programs goes beyond HIV prevention, and efforts that are about bringing HIV prevention, SRH family planning forums, forums, etc., decision-making forums together. And then finally, interventions that support a greater role for the commercial sector. I hope it's really clear about our interest in this work. Thanks. Back to you, Rosemary.
Thank you, Susie. And I think, colleagues, you've heard from Global Fund. Yes, they prioritize focus on condom investments, but this has to be balanced with other interventions, but therefore the issue on complementarity. I like the fact that you are sharing the interest in TMA, and Global Fund will look out for how this kind of guidance translates into proposals for GC8. The shift from the subsidized product to support upstream work in programming for sustainability, and the sobering reality that as of now, we actually don't know what it means for GC8 when it comes to HIV prevention generally and condom programming. But I think we get enough tips to take home with to inform our efforts at resource mobilization. I think on that basis, colleagues, continue dropping in your questions, your comments to the two speakers as we shift gears to our panel of 3 people. For now, I don't know whether Anne from Zimbabwe has managed to join. But as of now, we have, I hope they are all on board, Stella Gituku from Private Sector Kenya, Shiva from Yash Pharmaceuticals, Zambia, and Boniface I had seen from the Ministry of Health, Uganda. Do we have these colleagues on board?
Yes, they're on board.
Okay.
Yes, I'm on.
Okay, so you are all welcome, and I'm glad that we are picking from across the sectors. As I mentioned earlier, I know that we've had a love-hate relationship between the public and the private sector, not with the social marketing, but the full cost private sector. But now we have to be together on the table, and I know some countries have already been doing this. I will not go deep into introducing my panelists, but I will request them to add some more as they come to share with us. And allow me to start with Stella, Stella from Kenya, with a few questions. From your experience, what were the important elements of transitioning to a sustainable market in the past, and what opportunities do you see in the commercial condom market in Kenya, and why? And perhaps you can start by giving us some more highlights on what the social business means in terms of condom markets. Over to you, Stella.
Thank you very much, Rosemary, and it's a pleasure to be here. Just a quick correction, I'm from Population Services Kenya, also known as PS Kenya, and my name is Stella Getuko. I am the Director of Social Enterprise. So I'll just give you just a brief introduction of who Population Services Kenya is, then I can dive into responding to the question Rosemary has asked me. So in brief is we are social behavior change, social marketing and franchising organization that has been in Kenya for over the last 30 years.
Colleagues, Boniface, kindly mute. Thank you.
Okay, thanks. So as I mentioned, we have been in Kenya or have experience of over 30 years in social behavior change, social marketing, and then franchising in Kenya. However, we are a network member of Population Services International, meaning our work spans for a long period of time. Our vision is to be the leader in delivering sustainable health impact and private sector engagement in the work that we do. So in collaboration with other partners, we implement programs in various health sectors: reproductive, maternal, newborn, child, adolescent health, in the areas of HIV, malaria, as well as TB. So Rosemary asked, what does it mean in terms of us being in social business, or what does a social enterprise do? What we've done is, in support to the programming side of the organization, we have employed a private sector approach to do end-to-end sourcing and distribution of quality, affordable health products in various health areas, so HIV, family planning, water and sanitation, and over the years to ensure that we are sustainable, we keep adding new products to that portfolio. But let me focus on condoms, because that's what we are here to discuss. Rosemary asked a very pertinent question: what are the important elements of transitioning to a sustainable health market? For us, one of the key things that has really helped us over the years is in the element of sourcing of the products, ensuring that the manufacturers we work with are certified manufacturers, ensuring that the quality is of the right grade. We are compliant in terms of regulatory, and we do this because we want to ensure that we are able to provide an affordable product consistently. So even the manufacturers we work with are WHO pre-qualified, and this also helps us because we're able to ensure that the consumer is able to trust our product, which builds on our brand credibility, and we're also able to ensure that there's an affordable pricing in the market. You heard Chris talk about TMA approach, and PS Kenya was, that time PSI, was one of the pioneers of TMA in Kenya, where we were able to map out a universe of need, identifying who are those who have the ability to buy, and then intentionally developing generic communication together with the Ministry of Health or the government, so we are able to ensure that the market is crowded in terms of support from private sector as well as the government. That way, we were able to ensure that we can grow other brands into the market. And the other thing that was very important for us as well was to differentiate the packaging. So there was the packaging for the free condoms, and then there was the packaging for the condoms that were on sale. In addition, there has been a purposeful element of growing the health, the category, the condom category. And what we've also done is we've segmented the market. There are those who we just want the basic classic condom, but we've also over time been able to introduce variants so that we can target different segments. Availability is key. So how do we make sure that the product is available through the different supply chain channels, right from the distributor all the way to the retailer in terms of the last mile, and continuously ensuring that there's demand generation, and this has also played a very vital role. So looking at whether it's mass media communication, whether it's stimulating behavior change using below the line channels, applying all the 4 P's of marketing to be able to ensure consistency in that regard. And lastly, which is key, and that I think is what has helped us get through the channel of sustainability, is gradually moving from applying a cost recovery process. When we started this journey, products were subsidized so that we could ensure that there's entry into the market. But over the years, what we have done is reduced or completely gotten out of the reliance of donor subsidy, and we're able to ensure that we've recovered the cost fully. That way, we are able to ensure that we can sustain the product at the right price, in the right quality, and making sure that the market is resilient enough to have this product available in the market. I think I've answered your question, Rosemary, yes. So back to you.
Yes. Thank you very much. And I think you have ended on the best note, the fact that you have transitioned from donor subsidy and you are still in the market. Let's hear from Mr. Shiva from Zambia, full private sector. And let's hear from you about the opportunities you see in the commercial condom market, and why do you think those opportunities are there? And also, if you can hint on any challenges that may be limiting your participation in the market as of now. Over to you, Shiva.
Thank you, Rosemary. Okay, so should I start with first the opportunities that I see in the condom market? As far as the Zambia's condom market is concerned, it's very ripe for private sector innovation, anchored in local production, premium value branding, rural expansion, digital distribution, and female-focused products, of course. All of this underpinned by the partnerships that allow for scale and sustainability. Some of the challenges that was limiting commercial participation till today was, yes, have been discussed. It's the price competition from free and subsidized condoms. It's the public and the NGO sector distributing millions of free or heavily subsidized condoms, So commercial brands were struggling to compete on the price, as especially low income or the rural prefer free or nearly free options. There was a low willingness to pay as well when many consumers did not see the added value in paying for commercial condoms when free ones were available. Even the modestly priced commercial brands were at the risk of being overlooked unless something unique was being offered. A weak rural retail infrastructure, underdeveloped supply chains, commercial supply chains in the rural areas also added to this challenge. The other things that I would say is about the low awareness about female condoms and newer options which are available, brands offering about premium variants, struggling to gain traction due to lack of product education. And limited data on consumer preferences, usage patterns, stock availability, especially for the rural areas. It's very hard with this for the commercial players to plan efficient distribution, pricing, and marketing strategies, without clear demand signals. So because of this, many commercial entrants hesitated due to a lack of actionable market intelligence. So in summary, if I have to say on the challenges which were limiting the commercial participation, addressing these issues which I spoke about, like we are discussing today, it requires a total market approach, where free, subsidized, and commercial products are balanced to serve different market segments without undercutting each other. So having said this, if I have to talk about shifts that are needed to enable strong private sector engagement, would be to transition from free only to a total market approach, introduce price tiers and product differentiation, encourage and allow for tiered condom market where multiple brands can coexist, so the government and the NGOs can focus on free, the low cost can be taken care by social marketing, and branded, innovative, and premium can be done by the commercial sector. I mean, so this I think would help the private sector position its products by quality, features, and brand, and not just the price. And also, giving a message to explain the value of commercial options like comfort, sensation, design, and other things. I think as far as the Zambia, the rural commercial distribution, like I said, I mean, it's essential that we incentivize the rural. I mean, we can use social enterprise models to train, incentivize retailers in the rural sector or health workers, to stock and sell commercial condoms. The other thing is to normalize the condom use through demand generation. I think by and large the shift in messaging, condom messaging, from fear-based to positive themes, empowering, pleasure, trust, and control, which can build a sustainable culture of condom use and supports brand recognition, loyalty. All this can be achieved through collaboration with influencers, youth platforms, local creatives to reduce stigma, and most importantly, I think we need to have a streamlined registration and import procedures from the regulatory bodies, which can make it faster, cheaper for import, register locally manufacture condoms as well. And then regulatory bodies should consider giving fast track pathways, for WHO qualified product, which is something which is not fully been done yet as far as the Zambia market is concerned. And then I think I must mention this about facilitating the public-private partnerships, to create frameworks for commercial companies to partner with public health programs. This can enable shared infrastructure, like co-branded messaging, bundled health packages. So in summary, should I say that by making all of these shifts, Zambia can create a healthier and a more balanced market where private sector contributes actively to public health goals, while also building sustainable business models. There are a lot of ideas that we intend as a commercial entity for expanding, market access and participation, and we look at equal support. Rosemary, thank you for the opportunity, and I think I have covered what
Yes,
you had asked me.
I think that's powerful. The fact that you see that the business is viable, the market is viable, and you already have ideas around issues that touch on our health programming that impact business that we can easily focus on, and the need for the public-private partnerships if we are to go all the way. I think this gives us a perfect entry into a question to government, because governments usually want to provide free-to-use kind of services. But let's hear from Boniface. What are the challenges of engaging with the commercial sector, and what can actors do to address such challenges? And how do you see the commercial market and the social business fitting into the country's vision for a healthy condom market? Over to you, Boniface.
Thank you very much. Thank you very much, Rosemary, and thank you for having me. Just to pick it up from there, Uganda as what we call a national comprehensive condom strategy and implementation plan. And within that strategy, we clearly highlight TMA as one of the lead factors towards ensuring that we have a sustainable condom market. Over the years, in 2021, we came up with targets. And by then, really, our market was fully dominated by the free-to-user condom. So within those targets, we said by 2025, from about 83% being public sector, we thought we would reduce that to about 69%. And for social marketing cost recovery, we thought by then we had about 11%, and our projection by 2021 should be about 2020, and by 2025 should be about 21%, while the fully commercial should be about from 5 to about 10%. However, over the years, through our quantification exercises that we normally use, the CNET, that's the condom needs estimation tool, we have been able to factor that out, making sure that even as we do the quantification, we reduce the numbers based on the targets that we had set out. As for instance, 2024, our universe of need was about 418 million condoms, but in terms of the breakdown, we're able to use those factors that I've already stated in there. In terms of the challenges of engaging with the commercial sector, I think one of the key areas that has been affecting us was lack of a streamlined guideline that clearly states what the roles of the commercial sector are, has been one of the setbacks. But through the support that we received from the Global Fund, we are in the process of developing what we call the social marketing guideline. And within that, it's able to clearly streamline what the commercial sector should be able to do. Equally, we have come up with what we call the TMA vision, and some of the issues I said earlier fall within the TMA vision for the country. That is equally able to show where each of the players is able to participate in terms of the percentage of the market. When you look at our targets for 2021, for instance, we realized we had a target of about 10% by 2021, but where we are now, we're about 7.7, which is quite some progress towards achieving that. We have equally realized quite a number of commercial sector players joining the market. Apparently, we have close to 55 condom brands on the market. So I think this sort of makes our market very sustainable. We just basically need to coordinate more and make sure that the market is fully segmented and we know where each of the players should be able to participate in. We have done mini segmentation surveys, but we think going forward, we need to do a national level survey so that we know where the key players should be, where we should be able to distribute our free-to-user condoms. As clearly stated by Jones, we don't want to distort the market, looking at the current dwindling funding challenges that we are facing as a program. Really, from that, we realize about 77% of our market right now is being led by the commercial sector. But still, with the kind of numbers that we have from the public sector, there is a bit of distortion here and there. And that is the kind of management that we want to see, that we manage the market effectively. And how are we doing that is through what we call the TMA task force, where we meet on a quarterly basis. We bring in players from the commercial sector to come and share their challenges, and we work out ways together on how to improve our working relations. Of course, we are also doing rebranding of our public sector condom, but we are also cognizant that we don't want to go very far so that we don't bring more competition to the commercial sector players as well. And in terms of challenges, I think our public-private sector partnership, we have just started on it, is still work in progress. And we think that is an area that will give us leverage in terms of distribution as well as demand generation. Apparently, we have pocketed demand generation campaigns here and there, but that should be unified. And we have a national level campaign that is able to promote condoms across board. You see, I know there is still a challenge of tax, or especially for the commercial sector condoms, but we are in negotiations and see how that can probably be reduced or completely eliminated for condoms, so that we make sure that we have our sustainable market. Another component, the understanding of total market approach in the commercial sector is still not forthcoming. So we would want to do more technical assistance to the commercial sector as well to make sure that they are on top of the game in understanding what total market approach is all about. I think in a nutshell, that's what I could share about
Thank you.
Uganda.
Thank you,
and over.
Boniface. I think that's clear progress. Our time is up for the panel, but I think I will give Stella a few seconds for you to tell us what you think, what you would like to see the public sector do for the social enterprises. We've heard from the full commercial private sector, but let's hear from you just in a few words before we can open it up to colleagues.
Okay, thank you so much, Rosemary. So your question on what we would like to see from the public sector moving forward, I think I won't belabor on the point, but having an actualized TMA strategy that, as the speakers have rightfully put it, those who spoke before me, this actualization of the TMA strategy would create a fair playing ground for public and private that would focus on stimulating commercial uptake amongst the general population. There also has to be a concerted effort in regards to increased investment in creating demand and awareness of condom use, especially where behavior change campaigns are involved, focusing a lot on the youth. I mean, we've seen, especially in Kenya, the rise of teenage pregnancies increasing and spread of STIs just because of inconsistent use of condoms. And this would also require collaboration or implementation of also mass media campaigns on just the normalization of condom use. There also needs to be enhanced regulations in regards to cross-border reflows of products, because we see it specifically in Kenya, where you find leakages of product moving from Tanzania to Kenya. And what that does, it just completely fragments the market. So how do we ensure that there's stronger custom checks? If it's in regards to concerted efforts, say with the East African community, how are we ensuring that there's an enforcement of quality, even in terms of standards, also mitigating cheaper products that may not be of the right quality in the markets. And lastly is around market surveillance, ensuring that the products that are in the market are quality assured, reduction in counterfeits, because that also impacts a lot in what the commercial players and also social enterprises like ourselves are doing. Because what then happens if the market surveillance is not strong enough, then you have a lot of substandard imports coming into the market, counterfeits coming into the markets, and then this will, of course, fragment the market in regards to protecting of their safety, as well as ensuring that there's market integrity for the various brands that are in the market. Back to you, Rosemary.
Thank you, Stella. I think colleagues join me to appreciate our panelists. They have really picked the pertinent issues that we need to face, that we need to address as we transition the condom markets in our region. I believe there's been questions in the chat, and there are also attempts to answer them from the different speakers. But now let's give ourselves like 10 minutes for those who want to raise their hands. 3, 4 questions that we can take on as we look at what we have in the chat. Lucy, you can assist to flag any outstanding questions in the chat that may have not been addressed by the speakers.
Yes. Thank you so much, Rosemary. There is a question here from Timothy Wambogo. asking whether there has been any initiative to consolidate the volume of condoms sold across Africa so that we have a viable manufacturing facility, since most of our requirements are imported. I don't know if any of the panelists, Chris maybe, or Sue.
Chris?
Yeah, thanks all. We have been able to consolidate needs overall in Africa. I think it was presented earlier in terms of procurement needs, at least. We would expect those to decline. But also to note that importantly, it's hard to justify manufacturing on the continent. There has been 2 manufacturers that existed in the past 5 years or so, one in Botswana and one in South Africa, both which closed because they weren't able to be commercially viable, even for and competitive, even for government procurement, simply because the raw resources and materials and manufacturing costs on the continent didn't make it viable. It's not to say that will always be the case, but in the past, there hasn't been great success in manufacturing on the continent.
More, Lucy? I hope that answers Timothy.
Yes, there is also a question from Manuel Julio Sambo, and he's asking, how can free condom distribution be made possible by strengthening social marketing, establishing a specific market share, and measuring market coverage? He says, as he sees it, there is a low level of coverage of commercial condoms, and this means that at a social level, there is low demand and social appropriation.
I believe Shiva tried to answer that when he was talking about the rural market and the need for the social business enterprises to set in and inspire some processes. But who can take it on between Stella and Shiva?
Yes, I can add on to what you said, Rosemary. Yeah, so I guess this touched around what people was talking about, where what are the opportunities of the commercial condom market in Kenya? And based on what I had mentioned earlier, there's of course increase in demand creation, but there's also the element of a private-public partnership where manufacturers and importers, this would now, when I say private-public, I mean the private sector and the public government, seeing how they can be able to support both manufacturers or, in this case, importers through incentives. And these incentives would go a long way in ensuring that we can actually make them affordable. So case in point, in Kenya, the cost of a condom has a 16% value-added tax implication to any import that we bring in, meaning that that element makes it a little bit less affordable, especially for that person who they may be getting the free commodity, but there's an element where they would be willing to pay if the cost was slightly less. So how do we advocate for tax exemptions so that we can ease that burden? And of course, that will then hence encourage a broader uptake. And also the other element that I could point on would be, depending on what the agenda is of, say, for example, the government. In this case, there's a big 4 agenda on supporting local manufacturing. So as Chris rightfully put it, he gave examples of markets where it has not worked. But is there a concerted effort with the public where there's concessions or incentives that would encourage people to manufacture, and what that would then eventually do is increase consistency in supply as well as develop the economy, because there's also job creations and just supporting the greater GDP of the country.
Thank you. Chris, you have anything to add there? I don't know whether Lucy has any other question.
Yeah, I have some questions from Gabriel.
Yes.
And he's saying the different sectors, public, social, commercial, have varied priorities and interests. How are they coordinated, and what is the spread and coverage of the TMA across the countries? And I think these are for Uganda. What has been government commitment, including funding for the successful TMA implementation, particularly in funding and coordination? I think this may be for Boniface.
Boniface.
Thank you very much, Gabriel, for that question. Apparently, in terms of funding for TMA implementation, what is happening right now in terms of stewardship at the national level, we have what we call the National Condom Coordination Committee. And within that committee, it brings on all players, both the private, the commercial and the public sector together. And within that, we sort of like try to streamline the different channels on how each of the players is able to operate. And as I stated earlier, we have also guidelines that have been developed. The TMA guidelines are in place. So within that, that is also another approach that the government is taking to ensuring that the public sector and the private sector players equally know their roles in terms of the terms of reference of their work and all that. Specifically in terms of funding, we still limping in that area, but looking at the resource envelope internally in country, we are still under discussions to make sure that at least we have some allocation specifically be allocated to the condom. But as per now, we seem to be heavily still on donor reliant, but with the current environment that we're working in, it has now reawakened us to think more on how to make sure that that engagement and financing is being able to be identified internally in-house. Thank you, and over to you.
Thank you. I think we have like 13 minutes left to our webinar. I wish we could have a platform where members can drop in what they think should be the actions for the way forward that we can also pick as part of the summary, because these issues depend on different contexts. But I don't know whether, Chris, you have some final inputs, especially after hearing.
Sorry, Rosemary. Rosemary,
Yes.
I just want to make one intervention, and I'll seek your indulgence to do that.
Yes.
And that has to do with local manufacturing of condoms and lubricants in Africa. I listened to the response that we got, but I tell you, if we are going to talk about sustainability, and if we are also going to talk about utilization of local technologies, and also talk about job creation, then we need to ask ourselves, how come local manufacturing of condoms is not prioritized, or it has failed in some clients that it did? I think we need to really interrogate that if we are going to be very serious in terms of sustainability, in terms of condoms in Africa. And I just I thought the World Bank was the Global Fund was going to be more specific, direct in terms of their advisory to countries in terms of prioritization of prevention of condom. I think they are line it quite fluid. It's not going to be in the best interest of anybody. Thank you.
Thank you, Gabriel. I think those are key points, taking it beyond health to the socio-economic empowerment aspects. I know that Global Fund has also supported the procurement from local manufacturers. But I think we need to study more to understand what happened in Botswana and South Africa for us to make a case for that, but we can pick that as an action point. I want to be sure that we've not missed questions from French and Portuguese speaking colleagues. Lucy? Are we okay?
Yes, we've managed to respond to most of them, but there is still one outstanding from Benjamin. It's in French. If we could get somebody to translate it. Do we have to bundle?
It's been translated, Lucy.
Yeah?
Okay.
It's been translated. So what he wants to know is, how has the panelists managed to control the flow of condom imports from the private sector in their countries?
That goes to government.
Thank you. Specifically for Uganda's case, all condoms once imported in the country undergo mandatory testing, quality assurance at the National Drug Authority before they are released to the market. And of course, at the end of the day, we have one import regulatory system, Uganda Revenue Authority. So all condoms that come in must go through Uganda Revenue Authority and must get a clearance, quality assurance from National Drug Authority. So that is the way that they are controlled. And of course, the ministry is informed about the numbers that have come in and we're able to track in terms of distribution. Apparently, we have also developed what we call the last mile tracking application, whereby once all those condoms come in, they should be entered into that application. It's not full yet there, but that is now the target where we are going, to make sure that whatever condoms that are enter the country, the importer has to receive them in that application and we know how many they are. And then when in terms of distribution, or which region they have been taken and all that. So that is the approach that we are currently taking. We do quality assurance, testing, post-shipment testing in-house, in country. And then, of course, the taxation issue that I talked earlier about. So those are some of the ways that we regulate the number of condoms that come in country.
Thank you,
Thank you,
Boniface.
Anova.
But I know that you also have the issue of cross-border leakages and especially for the cheaper brands that Stella has raised. There is a final question on demand creation, generation to Boniface, but I think to all of us.
Maybe I could just respond to that.
Yes.
Through GC7, we got some support, which was really targeted, and this one was targeting our most at-risk population as well as the young persons. So we have been able to do those targeted demand generations within Kampala and some other high-risk districts. But also working with partners, we've been able to have all their messages cleared at ministry. So we have this, I would call them pocket sort of demand campaigns for different condom brands. But overall, we do encourage them. Once you come up with a message, you bring it to the message clearance board at ministry, we clear, and then you're good to go with the demand promotion.
So it's not like a mass national campaign, but you have a mechanism for clearing those who can fund their message.
That's correct.
Okay. Perhaps I would put that question to Susie and Kara. You did mention that Global Fund will progressively consider upstream kind of work. I know that support to demand generation has not been something very popular, but would it be something that can be considered as part of an integrated package, not condom specific, under GC8?
Let me jump in straight away to be crystal clear on that. Definitely. Absolutely, yes. The thing I would add, though, which makes it, I think, a little bit more complicated is the second investment area that follows condoms as a category is demand generation and prevention communication. So it's like the condom category was something like 200, in excess of 200 million for GC7, and right behind it, higher than our investment in PrEP, for example, was our investment in demand creation and communication. Problem is, in every country, the way these budgets land is very different. But I would say we're already spending millions and millions on demand creation. And if it's not making it through to demand creation programs for condoms, then something's not working. But I mean, the first principle is our interest in demand creation for HIV prevention, all prevention, including condoms, is really clear, yes. But I would say we're already funding a lot. And if something in your country, if that other investment, communication, demand creation, is not making it through to the condom program, then I would say to you, something's not working. Over.
Thank you. I think that's clear. We have 5 minutes. I don't know whether there's anything still burning. I will just attempt to summarize some of the action points that are coming out Definitely, it shows there is interest for this market transition and TMA specifically. And we've heard that it's viable, and it's largely a stewardship thing at a government level. The need to activate public-private partnership platforms to get the interests of everyone and take it to the common direction. The need for TMA strategies, as shared by Uganda, that can assist us to understand these tiered condom markets. Need for market science, including segmentation. We've heard of rural, urban. We've heard of those who might not pay and the willingness to pay. The need to set targets and work towards them. Aspects around the political and policy environment, on registration of products, on import regulations and tax regimes that need to be addressed. Guidance for GC8, which is very specific to Global Fund, and the guidance that we are moving from product procurement to upstream work, and it links to the next one, concerted demand creation, that also picks on what the private sector can do and what government can do. But we've heard now from Global Fund around the integrated piece. There are issues around local manufacturing for us to look further into and see what comes out. This is not specific to any party, but I think we have like regional economic platforms and so on that can pick on such an issue and take it further. Aspects around quality assurance and market surveillance, which I believe would be part of any sound condom program in any country, but would also look at enhanced cross-border aspects. I don't know whether I've left anything that you think we can pick before we wrap up. Across my panel and my two first speakers before we close.
Thanks. I just wanted to reiterate, like, this is a great conversation to have, and we want to continue to support it. And I said earlier, we will be working on developing resources and materials that will be available and disseminated through our partners like UNFPA, the Global Prevention Coalition, and UNAIDS, and the Global Fund to help countries work through some of these difficult challenges. Great questions in the chat, and we will be sure to incorporate those. But just to reiterate as well, I think there's a number of questions that were brought up around demand, and just to reiterate how important quality demand interventions are in supporting use and growing the entire category. And wherever possible, looking at demand investments for the entire category so that Mr. Shiva's condoms in the commercial sector and Stella's condoms in social businesses can benefit from increased demand, as well as the public sector, and so that every user can access a condom that fits their need. But thank you so much to the SSLN for organizing this workshop. Rosemary, great facilitation as always, and to colleagues out there in this endeavor. Thank you.
Thank you. I think I will hand over to SSLN. I don't see any other submission. Thank you very much to the panelists, to the presenters, and to the audience. I think we have now a good foundation to base on to follow up with the different country teams and support them to develop different pieces. Over to you, Lucy and Madonna. Thank you.
Yeah, thank you. Thank you so much, Rosemary, for very wonderfully navigating us through this conversation. It's been very refreshing to just hear the different sides. Thank you to our panelists for coming on board and sharing your experiences. I just want to say that this is a conversation that should continue, and hopefully, yeah, in the near future, just look out for more sessions. Thank you so much, everyone, for attending. Thank you, Chris, Carla. Thank you, Susie. Thank you, everyone, to the SSLN team. Thank you so much. God bless.